first thing you want to do when doing trach care is to check the doctor's order, name, date, name the patient's name, the date, any allergies. Once you check the doctor's order, you'll grab your supplies, which is your hydrogen peroxide, your normal saline, your post ox, your trach, suction catheter, your trach care kit, and your drape. Once you have all your supplies, oh, and your stethoscope. Once you have all your supplies, you can go into the patient's room. You knock. You introduce yourself. My name is Jacob Decker. I'm a student nurse, and I'll be performing trach care for you. You'll wash your hands. You'll check the patient bracelet for name, date of birth, okay? And the doctor has ordered trach care. So, but before that, I'm gonna check to see if there's any crackles or gurgling sounds. And you can use your your post ox to check O2. And you'll check 4 or 5 lobes. 1, take a deep breath for me. 1, take a deep breath for me. 2, take a deep breath. 3, take a deep breath. 4, and if you do a 5th lobe, take a deep breath. Okay, I did hear some gurgling noises or crackling noises, and your O2 is low, so I am gonna do some suction today. Okay, once you do the suction, you'll turn on oxygen. You'll turn on the suction and connect it to the suction catheter. Okay, then you'll drape the patient. Once you drape the patient, you can open your catheter kit, and you can take out your gloves, being careful when you open them. Okay. With your dominant hand, you can put on your glove and close this. And then you'll do your sterile field. Make sure you grab the corners. Grab the corners and make sure the smooth side is down. And then using your sterile hand, you'll grab your equipment. Okay, so you're supposed to grab this. You're not supposed to have it unraveled like that. And making sure that you grab everything that you need. Be careful. Okay. So once you have your equipment, using your non-sterile hand, you'll pour your saline. You'll pour your normal saline in trays, and on your big tray, you'll pour your peroxide. You'll pour your peroxide. Once you have that, you'll open. You can put on your second glove. And you can start. Okay, before you put on your sterile glove, your second sterile glove, you'll go over here and remove your inner cannula. Then you'll put on your second glove. Once you do that, keeping your dominant hand sterile, you'll do suction, which you'll go in at 90-degree angle, and remember to always suction when you go out. Suction. If you still do hear some gurgling or crackle sounds, you can suction again, making sure that you suction when you go out. Okay. After that, using your clean hand, you'll you're gonna clean your inner cannula, and you're gonna clean, 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 and you're gonna rinse and almost saline, okay. And after that, you're gonna grab a 4x4 gauze, and you're gonna make sure all areas are dry. Once it's dry, keeping the inside sterile, you're going to replace your inner cannula, and that's when the sterile technique is done. Okay, you can get that out of the way. Then you'll remove your dressing, your previous dressing, and using a Q-tip and normal saline, you'll clean around the area. Throw that away, and as you clean that, make sure that it's dry. Make sure that the area around is dry. Okay, you still have the strap on. And before you put a new strap or string on, you want to pump up the bubble inside, and you'll grab your string, make sure it's not all over the place. And on the side that has your knot, that's where you'll apply. That's where you'll start your new. That's where you'll apply your new. I'm having trouble, but that's where you'll apply your new. That's where you start your new string. Okay, keeping that in place, making sure with the bubble it should be secure, but you still want to check, making sure that that's even. Okay, you'll have the patient tilt their head up slightly and go around. And on this side, on this side, this will be where your new string is. Make sure it's an inch or inch and a half, so it won't irritate the patient. Okay, and it's on secure. And make sure it's on securely. Then you'll remove the old. You'll remove the old. Coming back over. Okay. Once you remove that, you can remove the drape and replace the dressing. Replace your dressing. And then, okay, I'm gonna check sound. I'm gonna check for sounds one more time. Check 1, 2, 3, 4, and if you do check the one, check the 5th one. Okay, and check your O2. Okay, so it is. I don't hear any. It's the hearing is better, and your O2 is a lot better. Okay, so I'm gonna give you your call light, and I'll be back in about an hour, hour and a half to check on you, and then you'll clean up, take your gloves off, make sure that you document everything, wash your hands, and clean up, and that's the end of the procedure.